Hi, my name is Chloe Mbala, and today I will be presenting on multiple sclerosis. So, what is multiple sclerosis? Multiple sclerosis is an autoimmune disorder that chronically impacts the central nervous system, which includes the brain, spinal cord, and optic nerves. When one has MS, the immune system attacks the protective layers of myelin that surrounds the nerve cells. This slows down or blocks communication from the brain to other parts of the body. It can lead to a variety of potential symptoms based upon where the MS lesions occur. MS is typically characterized by unpredictable symptoms that will wax or wane. The most common symptoms include severe fatigue, sensory changes such as numbness or tingling, reduced muscle strength or mobility, visual disturbances such as blurred or vision loss, tremor, cognitive impairment, including memory problems or concentrate problems with concentration or focus, and alterations in bowel or bladder function. While some individuals experience intermittent relapse or recovery episodes, many people will slowly decline over time. The majority of people who receive a diagnosis of MS do so at some points between their 20th and 40th birthday. More women have MS than men. While there is an increased risk for MS among those with a family history of the disease, other factors may include smoking, lack of sufficient vitamin D, and having a previous episode of EBV infection, which all seem to be factors that can contribute to an individual's likelihood of developing MS. In addition, studies show that the prevalence of MS increases as one moves farther away from the equator. Myelinated nerves allow for fast transmission of nerve impulses. However, in multiple sclerosis, inflammation destroys the myelination and causes scarring known as plaques that interfere with signal transmission from the CNS to other parts of the body, including muscles, sense organs, and eyes, resulting in a variety of symptoms such as muscle weakness, decreased sensation, difficulty coordinating movement, and visual disturbances. The repeated destruction can result in permanent loss of neurons and atrophy of the brain. So, how do we diagnose MS? To diagnose MS, you need to evaluate multiple factors, including medical history, neurological exams, lab tests, imaging, and a physical exam. No one test will confirm if a person has multiple sclerosis. The clinician needs to have enough information to determine that damage has happened in different parts of the central nervous system at least once on different days. Finally, they need to make sure that all other possible causes of similar symptoms are excluded. For example, some people may get similar symptoms from an infection, a deficiency of certain vitamins, lupus, or even a stroke. An MRI is considered the most useful method for diagnosing MS. An MRI uses magnets and radio wave signals to produce high-resolution images of the brain and spinal cord. The results from an MRI will show plaques, active inflammation, or new areas of injury as part of the diagnosis process. Most individuals are diagnosed with MS once the MRI shows signs of these symptoms. There are also several more tests that assist with the confirmation of MS. A neurologic examination evaluates reflexes, muscle strength, sensation, and coordination. A spinal tap is performed to collect CSF and check for oligoclonal bands, indicating that there is an autoimmune response within the CNS. Evoke potential tests show how quickly the nerve conducts signals when a stimulus is applied and may show reduced velocity of the signal. Additionally, blood work helps eliminate many other diseases or conditions that have similar symptoms. So, who gets MS and how do we prevent it? There isn't a single method for preventing MS. However, if you're looking to reduce your risk, there are many health-related actions that may assist. These include not using tobacco products, being at an adequate level of vitamin D, regularly exercising, as well as living a generally healthy lifestyle. While MS was more common in historical reports among white population, it has been found to affect individuals of all races and ethnicities. Most young adults are typically identified with this disease. What is the societal and lifestyle impact? MS has a significant impact on an individual's quality of life. The symptoms of MS often limit the ability for an individual to work or attend school as well as their independence. In addition, there are many expenses related to treatment of MS, including costs of imaging studies, medication, and therapy. Individuals with MS may also have increased level of emotional distress, such as anxiety or depression. Additionally, family members may take on the role of caregiver, which will create additional physical and financial burdens on them. So, what is the cure? While we do not have a cure yet, treatment options have come a long way. DMs help by limiting the number of times you experience relapses and slowing down the progression of the disease. If you experience a flare-up, steroids can be useful. PT or physical therapy will improve your ability to walk and strengthen you. There are other prescriptions medication that can provide relief from your pain, fatigue, or bladder symptoms. In addition to treating your physical symptoms, supporting your mental health is very important for your overall quality of life. In summary, multiple sclerosis is a long-term medical condition that affects your central nervous system. A rapid diagnosis as well as correct diagnosis will enable you to receive better treatment. To diagnose MS, you will need to be tested using several methods instead of just one. Currently, while we cannot say that we have an exact cure for MS, the best available treatments at the present time can assist with reducing symptoms and decreasing the number of relapses. This can allow individuals to maintain the quality of life. As researchers continue to conduct studies regarding MS, they give us hope for the future. Here are my references, and thank you for listening.